What are the common causes for osteoporosis? I'm Dr. Wendy, physical therapist, and I am going through a list of all the things you need to know about osteoporosis. Whether you're perimenopause, menopause, postmenopause, these are the things I want you to know, ladies. In a nutshell, osteoporosis happens when there is decreased weight bearing, decreased activity, and there is a change in the minerals in how your bones build and reabsorb. So as estrogen leaves the party and you are losing estrogen, you're also losing your will to want to do activities and get up and move around. But your bones need you to get up and move around because that is how we build bone. There is actually something called Wolff's Law, and Wolff's Law states when you apply stress, bone will grow. So you don't move, this triggers calcium reabsorption in your body and ends up in bone loss, which bone loss is osteoporosis. The greatest risk factor you can have for having osteoporosis is being a female. That's right, having a vagina puts you at risk for so many diseases, but the reason is because estrogen helps you maintain all things good and sexy in your body, and that includes your bones. Other things that put you at risk for having osteoporosis is, well, being a really thin white woman. Yeah, that's right. The thinner white women are actually at a higher risk than us husky girls because us husky girls got to carry our body weight around so our bones are a little denser. One of the few pros of being a big-bodied booty girl, so. Having steroid use increases your risk of osteoporosis as well. Having thyroid issues. Smoking is huge for osteoporosis. If I were you, I wouldn't smoke just to keep my bones healthy. Drinking too much alcohol can leach all sorts of goodliness from your bones, so drinking is a bad choice. Not getting enough nutrients as a child also affects your rate and risk for osteoporosis. And the other factor that I have said is when you are inactive, you have a higher rate for osteoporosis. So if you want to have stronger bones that are brittle snips, I need you to quit smoking. I need you to walk. And I need you to lift 3 times a week. I need you to take your D3 with your K2 and your calcium. But you can't be taking your calcium with your magnesium because it affects the absorption. I also need you to take your calcium with your meals because it is better digested with a meal. So take your calcium in the morning with food. Hit the plus sign and follow for more women's health.